Alrighty, good evening, everyone. I'm pleased to welcome Dr. Barrios. So, just a little bit about him. So, Dr. Barrios is a board-certified general surgeon with added qualifications in surgical critical care. He's a health sciences clinical professor of surgery at the UC Irvine School of Medicine and is a practicing trauma and general surgeon. Oh, sorry, give me one moment. Dr. Barrios completed his training in surgical critical care here at UCI in June of 2007 and subsequently joined UCI in July of the same year. Dr. Barrios is the director of the Trauma Division Research Program, director of the Critical Care Core Lecture Series, serves as the chair of the UCI School of Medicine Admissions Committee, and is chair of the Organ Donor Council. Dr. Barrios' clinical research in trauma and critical care issues includes the utility of thoracic CT imaging in trauma patients, anemia, end-of-life issues, etc. His work has been presented at numerous professional conferences and has been published in a number of peer-reviewed journals. Dr. Barrios is also a passionate humanitarian volunteer. Since 2011, he has participated in 9 mission trips to date in Nicaragua, Peru, El Salvador, and Colombia through the International Medical Alliance Organization. Everyone, please welcome Dr. Barrios.
Thank you. I guess I know how to do time management. So today's topic, being the assistant dean of admissions, I'll throw that out there for UCI School of Medicine. I kind of go on the talk show circuit, I call it, for So You Want to Go to Med School. To me, the purpose of that is to answer all the questions that everybody has about, like, how do I get there, right? That is a wide, very complicated issue, but one of the things that I get requested is to do some of the subtopics. So in your activity section, when you're going to apply, you're going to get research, clinical exposure, and community service. And I tell people, why do we generally do those 3 areas? Are we trying to make you go through loopholes, jump through hoops? Like it's not that at all. I will briefly talk about the other two. The other two are, one is to make sure that you know what you're getting yourself into, clinical exposure, right? You have this vision of what you think medicine is, but what have you done, and can you prove to me that you've looked into what it is, that you have an idea of what it is, that you're not going to all of a sudden go, oh, this is not what I thought it was. And so that's why we make you do that. And the community service really comes along on along the lines of medicine is still a little bit of a sacrificed field. And so can you give us an inkling that you're willing to give a little bit of yourself that has nothing to do with doing something that you're going to get anything in return for other than just out of service? And so those are those two, and that's not what we're going to focus on today. Today we're going to focus on research, right? And that's a little fuzzier, and it's a little hazier, and it's a little, like, some people say, why are you going to make me do research if the large majority of you are not going to do research once you graduate and go into residency and things like that? And there's a couple of really good answers, right? So one of them is, as a physician scientist, like, we do things, we pat ourselves on the back, but are we really doing the latest and good thing for the patients, or has technology moved on, or has the science moved on? And are you part of that science, right? Because I tell people, think about it. If nobody did research, we would still be leeching people. We would still be doing trepanations. We would still be doing bloodletting to let out the evil humors. We don't do that anymore. And why? Because people have come along and questioned it and looked at it and devised experiments, or looked at results and reported on results, and moved the technology on and improved how we care with people. Like, I can tell people, like, for instance, even during my own career, we're not looking at hundreds of years. Well, even though some people are starting to say that about me, but that when I first started, I took people's gallbladders out by making an incision under their ribs on the right side. And then, I was even in residency, and it was kind of interesting how people started doing gallbladders laparoscopically. In other words, making small incisions, putting tubes and cameras and instruments through the tubes, and taking the patient's gallbladder out that way. And then now I'm doing it robotically, right? Now I use a robot to help me take the gallbladders out. And so none of that would happen if there weren't people in the background doing experiments, checking out if a new technique was better. And the field has increased too, right? Because now we have, bioengineers but let's say you design something. How do I know that that's going to work, right? I have to try it on somebody or something. I have to try it in a lab. I have to try it on an animal, and then I can try it on human beings. And that's all research, right? When you think about it. But research is a different and wide variety of different things. So people always think, especially at your stage in if of, pre-med, that it involves sitting in a lab, pipetting things, doing something to a mouse, um, agar plates. These are what you consider research. But I will tell you, but research is three categories. Research is what, it's the basic science research, the wet lab, the dry lab, whatever, but a lab, or even, animal models. And that's basic science research. And at your stage in the game, that's probably an okay thing, because this is the time in your life when you're going to have to like sit in a lab and pipette something and come in on a weekend and see if, whatever you started worked. And hold on just a second. I'm getting a lot of glare here on my screen, and it's my fault. Hold on. And so there's that. And then there's the second category, which is, well, that's better. Y, y el de la cocina también. What I call the outcomes, which is the data driven, which is, and we're going to come back to it because this is a good sweet spot for a lot of people when you're in med school and when you're in residency, because you don't have time to carve out unless you're going to do an MD, PhD, to sit there and do the wet lab, basic science, animal model type stuff. The outcomes research is patients who have come and gone, and the data is there, and the data is sitting in a computer, or it's in, somebody's head, and they have access to it in terms of like, oh, I can look it up easily, data banks. And these, I'm going to get back to you why that's the sweet spot. And then there's the clinical research, right, which you also associate with science. You're actually literally working with patients. You're waiting for the right patient that meets the criteria to come along, and then you sign them up and you do whatever procedure or thing that you're going to do with them, and you randomize them, and one of them gets this thing and the other one patient gets another option. And so that's clinical research. And again, very time consuming. You have to be there when the patients show up. You have to figure which ones are the right patients. And you have to sign them up. You have to make sure they go through whatever it is that you're making them go through. And then you can analyze the data, right? So also very time consuming, probably not terribly realistic, unless you're going to make it part of a job. And for some of you that are going to do gap years eventually before you go to med school, that's not a bad thing. Clinical research is a popular thing to do. And if you make it your job, then you're making the time to do that. So, but again, once you go to med school and once you go to residency, that's probably not terribly realistic either. Although you can do some, and mind you, I'm doing a couple, but I need to have a team. I need to have a handful of people that can help me when one guy can't show up, another guy can show up. So not as straightforward. So I'm going to go back to the outcomes research, which if you look at my, I don't like looking at my own CV. It's like too long anymore. But if you look at what I do a lot of outcomes research, and it's a data bank, and there's different data banks. There's the hospital data bank. There's the trauma data bank. There's surveys. Even surveys count as outcomes data because you're looking for how patients were satisfied or not with something, and these are patients that came and went, or you're giving them a part, like, oh, I noticed that you were a trauma patient, whatever. Would you be willing to fill out a survey type of thing? Not as complicated and a little easier than waiting for patients with specific issues to come up that you can randomize and do something to prospectively. So that's a very important categorization. I'm gonna take this blur thing off. It's kind of annoying me. And yes, that's my kitchen in the background. So why does that matter? So retrospective versus prospect. So retrospective is again what I mentioned. The patients are come and gone. They're in the rearview mirror, and I'm just plucking the data out. Prospective means I am specifically gathering data as I go forward, and this could be something as simple as a survey. It could be the clinical research, right? Because I'm bringing patients in and I'm doing something to them into the future, and not something that's already happened. So catch phrases, keywords, retrospective versus prospective. So what do I often recommend? I mean, if you're in that position where you want to do some basic science, that's nice. You want to do clinical research, like I said, turn it into a job as part of your resume building, that's nice too. But I usually tell people that the easiest, nicest thing, and you can answer questions, you can even answer your own questions, right? Because when people come to me and say, hey, can I do research with you? I often tell them, like, well, I may have a project lying around, but why don't you go do a little bit of reading and answer and ask your own question? Like, you could figure it out, right? Like, why do you do this? Why do you do that? I occasionally have people shadowing me and go, oh, that's interesting. I see that you did this to the patient, or that's going on with the patient. Why is that? And that can turn into a research question. So that you can then look up the data and turn around and do some stats. So before I go on to any more descriptions of that, and I can tell you some of the projects that I did that just came on the fly. The other thing, and why are you doing all this if you're not going to do it into the future? Well, because what I also want for you is to be able to analyze the research and see if it's actually a good thing or not, right? Because there's all these papers they get pumped out, sometimes with somebody like a bias. Sometimes I have my own bias, right? Like I feel like I know what the answer is going to be, and that's the answer that I kind of sort of want. And so I look for the data, and sometimes it's kind of this funny thing that we say that we like, oh, if you torture the data enough, it will confess. And so it might not be the best study, or I may not pick the best patients, or I pick patients that I know are going to kind of give me the answer that I want. And then, so there's a selection bias, which happens in research, like you predetermine patients that are going to get you what you want. And so all of that goes into, or you just don't do the correct statistical analysis, or you didn't take something into consideration, like confounding factors. And so the point of that is that I want you, if you're going to do nothing else, when you read medical journals to increase your knowledge and keep your knowledge up to date, is to be able to analyze what you're reading, right? And be able to ask yourself as you read it, don't just read it and see what the outcome was and go, oh yeah, that sounded like a good idea. I want you to be able to ask yourself, oh, was that paper actually a good paper? Because I will tell you that I read papers that it was so blatantly obvious that they reached the incorrect conclusion, based on how they tried to manipulate the data, that I want you to be able to do that, because I don't, you're going to get bombarded with all these papers that say you should try this or that. And then how do you know that that was actually a good paper and that you should be following what they recommended? Or you determine for yourself, like, oh, like, no, that's actually not a good paper and I'm not going to follow those recommendations. So even if you never do research again, I want you to be able to do that, and help data move forward. And I will tell you, I will give you a really, really, really good example that everybody went down that rabbit hole, right? So this one famous person from Europe was trying to get everybody to really control people's glucoses, right? So she gave them a lot of insulin, and she gave them even like an oral medication, and really and said, oh, you need to get everybody's glucose under 140. or under 160, whatever. Or even, no, sorry, under 120, right? Because your glucose range when you're fasting should be somewhere between 90 and 120. So she said, we need to get everybody under 120. And so she came out with her paper and she showed the outcomes were different. Like, yes, people tended to do better when the glucoses were under 120 and when you aggressively made sure that their glucose didn't go high, blah, 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 blah. Well, what she kind of sort of didn't tell everybody was, because she discarded that data, was if you really, really try to get people under 120, what ends up happening is that you make people get hypoglycemic. They will go under 90. You will overshoot. And it's been desperately shown that in patients with head injuries, you don't want them going under 90 because then your brain doesn't get enough glucose and it's undergone some trauma and you're not going to do as well neurologically. Well, as everybody then really started taking a good look and trying to reproduce what she did, like they found out that they couldn't reproduce it without making people hypoglycemic. And so then they went back and took a look at her data and they're like, wait a minute, you kind of threw this, swept it under the rug. And so that's the point, right? We were trying to move the technology forward. She was kind of sort of half right, but she was kind of half wrong a little bit too. And then what ended up coming of it is that we're keeping people under 160 or we're keeping them under 180, but we're not being as aggressive because then other people came along and did different studies and found different outcomes. And so the point of that story is that not all research is good research. And you at least have to understand when you get that flyer every month from whatever specialty you're going to go into saying, hey, this is the latest and this is the greatest and this is what we should be doing. Is it though? Right. And that's what I want you to be able to take things with a grain of salt. And recognize that a paper is good or a paper is bad. And was there selection bias? Was there, did they use the correct stats? That kind of thing. And so that's why we look for people. And then I'll tell you the other thing too. But that's why another one of the reasons we look for why people have they done research or not. It's not because we just want to torture you and weed people out. It's because we want to make sure that you're going to be good physicians using good science based on good data. And can you recognize when you're being given a paper that's pushing something that wasn't the right thing? And then the very last thing is that some of you will go on to do some research, right? I didn't think I was going to be that much of a physician scientist, and it ended up that I ended up liking it. And then to me, and you will find this over time, is there are certain skill sets, and this is why I torture my medical students, and my residents and even some of my pre-meds that come to me is you don't really know, and especially if you're going to be doing something with patient data, whether it's an actual clinical research project or it's this retrospective data outcomes analysis that I'm talking about. There's a lot of steps along the way. And my job is to teach you those steps because you're going to have people that were like, oh, here's the data and do some stats and then write a paper and we're good to go, right? No. So if you're going to be doing anything that resembles any kind of clinical, whether it's retrospective or prospective, data versus actual manipulation of the patients, you're going to have to write an IRB. What's IRB? The IRB is like any institution will have, it's an institutional review board. And I actually sit on our actually institutional review board at UCI in my other spare time. And so what is the purpose of the IRB board? The purpose of the IRB board is to make sure that you are not harming patients in your efforts to do research. So we look at your application to do a research project. Retrospective is easy because you're not really doing patient contact, you're just looking at their data. And then you have to worry about, breach of confidentiality. What if you accidentally let their information loose? But it's a low level and it's a low risk thing, as opposed to you're going to be doing one thing versus another thing to a patient. Like, let's say there's a new drug and you want to, patient A is going to get the new drug, patient B is going to get the old drug, do a difference. Like, what's the risk of giving somebody a new drug that you really don't know all the clinical effects of yet? So, and this all came about, this IRB regulations, from And some of you will be familiar with the Tuskegee experiments, right? Where they took African American patients and the patients had syphilis and they just chose not to treat the patients just so that they can see what the outcomes were of these poor patients that had syphilis. And as it turns out, syphilis really actually has very significant long-term effects. And so we don't ever want that again. So IRBs were created to protect patients and actually to protect the researcher sometimes, because we come back and if you think it doesn't happen anymore, well, let me tell you about one of our experiences, because we not UCI, but it was actually Chicago. But if you think it doesn't happen nowadays, the Institutional Review Board looked at a person who said, hey, I want to give these people an attenuated but a live herpes simplex virus to see if it's effective as a as a vaccine, almost, if you will. Um, and the Institutional Review Board not only told him that he shouldn't do the data, but that they actually literally like flat out told him you cannot do this. So what did he do? He went out, he rented a hotel room, he still put out the flyers. He got all these patients to show up to a hotel room, which by the way should be a red flag. And gave the persons these attenuated viruses to see if he could create uh, um, immunity to the virus. Well, guess what happened? Everybody started coming out with cold sores and complaining about, dude, you infected me with like herpes simplex virus. Um, and it did not end well for him. But the institution was like, we told him not to. Like, I don't know what you want me to tell you. So these things still do happen, and so the IRBs are important to have in institutions to protect everybody, not just the patients, but yourself. Sometimes like kind of tell you, well, you really shouldn't do that. So my job, the point of telling you these stories is that I'm going to make you, if you come to me and ask me for a research project and it's probably going to involve putting something into the IRB, that is the very first step. Has anybody else already thought of this idea? Right? You have to go to do a literature search, because what if you're going to write on something and somebody turns around and goes, listen, there's already 100 papers on this, like then you wasted your time. So important to know what a lit search is and how to do it. Important to know how to play with the IRB. Important to know how, like, what data are you looking for and why, right? Even something as simple as what data are you collecting, even if it's patients that you're not going to interact with and they're come and gone, but like, what is the point and what data do you need to get your study done? And then once you did that, the data analysis, and I'll confess, right? I came from an era where uh, doing your own stats wasn't a thing. Now it's becoming a thing. So I actually rely on my medical students or other people, or sometimes even statisticians, like to write out, straight out statisticians to get the data analyzed for me, because that's not part of my forte. So, and I know it's a long story, but I'm coming to an end, and I'll tell you what the point is. And then, okay, I got the data analyzed. What did it mean? How do I get it presented somewhere? So you're going to submit an abstract. How do you write an abstract? You will find that like you write an abstract, but the place where you're going to submit it to says, well, you only get 250 words and your abstract's 500 words, right? You're going to agonize over chomping that thing down. It's kind of like telling people to cut your baby in half. Like, what words do you let go to get your point across? That is its own art form. You get accepted. PowerPoint presentations, posters. What are those supposed to look like to make them look professional? And then finally, if you get the manuscript, how do you write a whole paper, which is probably going to be about 12, 13, 10 pages long, to talk about your research project, right? So that's its own skill set. So all these different skill sets go into getting your research out there somewhere, in the background. And so if it's something that you are interested in, really, honestly, long term, and you're going to go out there and do it, then I feel like it's my job to teach you how to do that and to show that you can do that, so that when you apply to med school and when you apply to residency or beyond, you can say, well, this is a skill set that I have that now that institution doesn't need to teach you. So that is a sellable skill set because you come pre-packaged. So if you're going to go into research, that's why this is important. If you're not going to go into research, again, I'm going to go back to like, um, at least you know how to read a journal and make sure that whatever somebody's recommending for your patient treatment is the right thing to do. So long story. One of the questions that comes up more often than not before I go on and let you guys start asking questions, because really that's kind of it in a nutshell, is like, what does the research need to be on? Bear with me. I'm going to walk. I'm going to turn my lights on because now the sun's starting to come down and I'm starting to look like a ghost in with my head just kind of floating around. Um, it doesn't matter what the research topic is and if it's something that you're never even going to go into anymore. Um, but I tell people it's kind of, I kind of joke. It's like, it could be, listen, underwater basket weaving is a left-handed technique better than a right-handed technique? I don't know, but you answered that question and it shows that you went through the process, and that you know what you're doing and how to analyze and how to do that kind of stuff. And so don't worry so much about what it is. Don't worry if you're in a lab working on mouse cancer, and virus infection versus like one day you're going to be a surgeon. Or don't worry if it was even like something as simple as, plankton, and if the temperature was too high, the plankton grows better or not. Not the point. The point is, did you go through the process itself? And so I don't want you to sweat about, does it need to be this or does it need to be that, or does it really need to be something entirely feasibly medical? It's like, don't worry about that. Just worry about the process and getting there, and put it out there, and that will be fine. So that is my one caveat, my one question that I get a lot that I don't want you guys to sweat about. So with that, I don't know if you had any other specific answers before we
Yeah,
open up to the
the,
audience.
I was going to throw this one out. Can you talk about, so this is this myth is out there that you need to have a publication in Nature before you apply to medical school. And can you talk about what level you need to be to get your name on a publication? Because people are like, you need to be like first or second author before
Oh,
you could
well, yes.
apply.
That is a
And
really, yeah, that is a really good question. So I will kind of sort of cheat and I don't tell you what our point system is, but that's the other thing that we look at. Like when and we use this for various and sundry things. We look at your hours, of how much time you spent in a lab with somebody, and a couple of things from that. I would rather you do one or two longer term things than work in 5 different people's labs for one summer. Um, a summer here, a summer there, this guy's lab, that guy's lab, or girl. But I would rather you do something long term. You just stick with them for a whole academic year or more. Um, and whether it's published or not is not the thing. And I can't divulge what our scoring system is, but I will tell you that um, actually having it published and actually having publications will only get you one more point. So is it entirely necessary in our calculation whether you actually publish something or not? No. I would rather really what you do, like I said, is do something long term, hundreds of hours, 1 academic year, 2 academic years, I don't care, with somebody, and get a letter of recommendation from them. That'll get you so many points. Um, and I could tell you about where to be on the paper too, but and then if you got a publication, that's nice and dandy, and like it's an extra brownie point. But the stuff that will get you the bulk of the points is, did you actually do it? Did you spend a lot of hours on it? Did you get a letter from that person? For various and sundry reasons, right? Because you can tell me that you did it, and you can tell me that you had a good experience, but did you though? And were you really essential? I would prefer, and it would be nice if not only did you put that experience in your activity section, but somebody actually wrote you a letter saying, hey, this really was a great kid, and he really did show up, and he really did work in my lab, and I really did have a good time having them there. And there's a whole science about getting a good letter of recommendation too, and I can go into it, but that's not the point of why we're here today. Um, but that's how we look at it. Good long-term stick-to-itiveness, and if you do 2 or 3 projects, that's, 2 or 3 professors, that's fine. But at some point, I'm going to start to say, like, why are you doing all these activities while you're trying to go to med school and all these other things? And is it realistic that you really did all that? So again, that's why it becomes important to have somebody corroborate your story. Do the long term, get the letter of recommendations. That's so many more points than one extra brownie point for getting the publication done. However, if you are part of a publication, this is how the scientific world looks at the order of the authors, right? So the person who does the bulk of the work, puts the project together, analyzes the data, does most of the writing, or even presents at the conference, that's who's listed as the first author. Okay, the second author is just that. They did the second most work. Sometimes it's your stats guy, right? Sometimes the first author did all the work except maybe they couldn't do the stats. And then the other person did the stats, and you can't, do the research project without a stats person. So they're also vital to the project. Or maybe you did all the work, but you can't go present it and somebody else is going to go present it for you. Maybe they're the second author, right? And so that's, as adults, that's for you to be on your honor system, and everybody agrees who's first and second author. Those are the authors that we look at. If you're third, fourth, fifth, sixth, whatever, it's kind of sort of nice. You'll still get kind of sort of the point, but we take it just a little bit more seriously if you were the first or the second author. At your point in the game, you're not going to be the last author. And so those are the things that we look at: the first author, the second author, and the last author. And who's the last author? The last author is the PI. He's the one who globally oversaw the project and the question and made sure that the data was correct, obtained, or made sure that the patients were assigned appropriately. Like, they're the overseers of the project. That's somebody like me. That's somebody who probably has gray hair. And so don't worry about being the last author now. Most important to be the first or the second author. If you're somewhere in the middle, still throw it out there. That's okay. You worked on the project. We're going to take it like, whatever, a tenth of a point in my mind, but that's neither here nor there. But again, it's also so much more important that if you were the third, fourth, fifth, somewhere in the middle of the names, that your research mentor got you that letter of recommendations. Because yeah, third, fourth, fifth, but then if they write, but you know what, they were awesome and they showed up and they got it right and they worked hard and everybody liked working with them. And I know for a fact that, when I sat there and chit-chatted with them for a while, they did some other community service and blah, blah, blah. That's the kind of letter you want from your researcher, that corroborates your story and tells us that yes, what you did was what you said you did was actually what you did. And that's how we look at that. Don't sweat it too much if you were third, fourth. Don't sweat it too much if you never end up getting published, right? Because these people that do like these very, very basic science things and are trying to create a new nucleotide, whatever, to see if something works, that project could take years, and you were part of it and you showed up and you did it and you pipetted, but that's not going to get published for a couple of years. So don't sweat it if you didn't get published. It's okay. Don't look for something like, and I've literally, and by the way, you want to piss somebody off, tell them that you will only do the project and work with them if you get a publication out of it. That is one way that I can guarantee you that person is passively aggressively going to make sure that you don't get on that project, because you're not doing it for the passion. You're doing it like because you want to check off a box
or
and
anywhere in that institution.
yeah. And I've had that a couple of times happen. I've like had kids that come and like, tell me, Will, it's awkward, but I just wanted to tell you that I only was really looking for a publication. I was like, good for you. Oh no, wait a minute. Somebody else already signed up. Sorry. No, bye. So that's a big don't. Don't worry about the publication so much. It's nice, but it's not essential.
Yeah. The other thing is that just know that if you're saying you're spending 400, 500 hours doing research, and if you don't get a letter from that person, that just says a lot about like,
yeah, the negative don't get a letter also speaks volumes. Do you need to get a letter from, if you did research with 3 or 4 different people, do you need to get letters from all of them? No. but like maybe the one that you spent the most amount of time with, or the one that you felt was most significant for you, to kind of show that yes. And that goes along, by the way, for all the other ones too, the community service and the clinic exposure and all that. Like you should get one letter from each of those activity sections, if you will, again to corroborate, and again to make sure you don't just get letters from people in your classes. Oh, he took bio 101 with me and he was great and he showed up to my office hours. And even if they write you like a really nice letter, like because you sent them your CV, which you should always send your CV when you ask somebody to write a letter for you. And like, oh, and I do see that they actually had passion for community service and they had passion for this and that outside of my class. That's the letter that you want. And the same for research. They did all this research for me. And oh, by the way, I know they also were like really active in their, college. They were the president of their sorority. They were the president of the, whatever undergrad committee institution thing, so that I can say that like, wow, this person's kind of like, speaks to the person that is either helping them to research or that they work in somebody's office, and you're spending a little bit of time with them chit-chatting, and you have conversations. So because it speaks a little bit subtly to your interpersonal skills. So that's why when people ask me why, what's a good letter? The good letter, because there's what I call the Boy Scout letter, which is like, they were clean, reliable, honest, blah, 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 which is like the Boy Scout oath, whatever. And it's fine and dandy. They showed up to my office hours. They were a nice kid. They asked good questions. That's the Boy Scout letter. Or this was their job and they showed up in time and they did a good job. I'm like, okay, Boy Scout letter. But what I just mentioned previously. Oh, and by the way, I know they also like were president of some sorority, or they went out and they fed the homeless, or they, dug a well in Guatemala, or so, which add not only corroboration, but adds and shows that you chit chat and interweave with people, which goes into the interpersonal skills part. Because if you went to the soup kitchen and you fed the homeless, but you never talked to anybody, that's probably really not a good thing. And you're doing it to check off the check boxes. So we can kind of tell. And that's why we encourage you when you get letters from these people, again, whether it's research or clinical activity or community exposure, give them your CV, and make sure that they add those little extra points. And that's the good letter versus the Boy Scout letter. And the Boy Scout letter is not going to hurt you, but it's going to be like, okay. So that's my philosophy on that.
All right. Matthew, do you want to get started with the questions?
Sure. So for our first question, what careers or majors would one pursue if we wanted to be engaged more in research and be in a lab environment rather than being one-on-one with patients?
Okay, can you read that one again? I kind of.
So what careers would you suggest one pursue if they wanted to be engaged more in research or be in a lab environment rather than being one-on-one with patients?
Got it. Okay. PhD. Go become a PhD somewhere. And I don't care what that PhD is in, but if that's what you want to do, then that's PhDs. That's literally what they do for a living, is they spend their lives in a lab. And they spend their lives trying to figure out how to get funding for their lab, what kind of research projects to come up with. And it could be clinical, right? There are MD, PhD physicians. In fact, we have a whole subsection of medical students that are MD, PhDs. We call it MSTP. But those kind of people are actually literally asking medical questions, but they're not physically seeing so many patients, or maybe they see patients once a week, but the other 4 days a week, they're in a lab, figuring out, what's going to make patient care better, but they don't want to have that much exposure to patients. So you can look into an MD, PhD, but if you are like straight up, you already know that you want to spend most of your life in a lab in whatever field, go become a PhD.
And they're very important to advancing healthcare and medicine.
Oh
So
my God. Yeah. Like I You can't, there's no way that we can do new drugs. There's no way we can do new devices. There's a whole lab that sits in UCI called it's not the Brenner lab. I can't remember the name, but their whole purpose in life is creating what I call the new toys. A device that maybe I don't have to put it inside the patient to measure their blood pressure, or maybe I don't have to put it, all I have to do is put it onto their forehead to see if their brain's getting enough oxygen. I mean, they are literally a device making lab. Um, and you can go into that. You can go into biomedical engineering, right? These guys, that's what they do for a living, is they make new toys for us. And or you can become a pharmacist and get a PhD in pharmacy and create new medications for us. They're crucial. I can't advance science without them. And so if that's your passion, by all means, please look into those fields and go. So I think if you want to spend a lot of time making toys and you can get a PhD is look into biomedical engineering or chemical engineering. A lot of engineering is built around making things better for the patients without you necessarily needing to touch the patients.
This is also something that kind of touch up on that. This person's asking that, they're in the lab, a couple hundred hours, and they mainly work with the PhD students and lab manager and not the PI. Who should they get the letter from? And, because probably the PI more than anything, he's probably in the lab once a week or twice a week.
Right.
Um,
It is okay to get a double signature from maybe the PI and or like the letters that we get often are, hey, literally, I didn't interact with this person very much, but I know that my PhD student really interacted with them and gave a glowing report, or part of what I'm writing was actually written by my PhD student, and or candidate. So there's ways around it, and it's still nice to get a letter from the signature from the PI, but like I said, there's ways of doing it with even if you didn't really interact with them, and that's just as viable as actually getting the signature from them.
I could just tell you from our the people that work with you more likely write the letter, and then the PI puts it on their letterhead and signs it.
Yep.
So if you're that kind of person that goes into the lab and poops on the lab manager, the PhD students, the other researchers, and thinking that the PI is basically going to say, sure, I'll write you a letter. Then it's going to ask all the other people. And more likely than not, they're going to write that letter for you.
Yeah.
And if they're not happy, the PI is not going to write you a good letter. This
Yeah.
is something that,
Or they will literally put something passive aggressive
yep.
in the letter. I've seen it before. They will write something like at
Matthew's
first.
a smart guy, but he's very,
Yeah.
he,
Or they will do a backhanded thing like say, it's amazing how much progress they made because, they struggled a little bit at first. Well, that's like that's a backhanded compliment, right? Like that's essentially saying you sucked at first and you got better. Or like, if anybody's putting in you got better, that's always like a double take.
the one that I've read is, when Matthew started with us, I'm just using Matthew as an example. He
Yeah.
had a really bad attitude, but he improved as time
Yeah.
went on. That's like, so though, like these are coded words that they know in academia, and the people on Dr. Barrios's end read those and they know how to read between the lines.
Yep.
So don't, but more than anything, know that you're not going to work with a PI. Certainly, if they're a full professor or those people are busy writing grants and doing other important work. So you're going to be working with folks that are just a little bit more advanced than you.
Yeah.
Some of them may be undergrads, and some of them may be younger than you, and so that's so treat every with respect and courtesy.
Yeah. So I cannot reemphasize that enough because that applies to your whole life and how you view things. Because I will tell you, we have had candidates that apply for residency and they were mean to our administrative staff, thinking that The administrative staff was just there to serve them in terms of getting the paperwork done. And let me tell you, like, there's a couple of people in our office that when they say, oh, that guy was mean to me, like, you're not coming to UCI. Because if you can't respect the people who make life feasible for you and count them as less than because they're administrative or whatever, like, you're a jerk. Like, and I don't want that in my office, right? So I tell people, and this is the examples that I give, I am nice to the people that clean my room when I'm on call. I knew the name of the person who would serve food in our attending lounge. And guess what happened from that? Like, he would call me Dr. Chris, and I would say, hey, Lorenzo. And it's like, I knew his name. But guess what? When that guy showed up, if I happened to be there before he stocked the refrigerator, he'd go like, hey, let me give you this like selection of sushi before I put everything else inside the refrigerator. You have no idea. Like the person who cleans my room, I accidentally dropped my ring in the room when I was on call, and I was flipping out. And I went back and I happened to bump into her, and I said, hey, have you seen my ring? And she's like, oh my God, yes, I have it here in my pocket. I was going to turn it in. I knew it was yours. And so I wanted to make sure I got it back. These subtle things that make, like, I can't operate in a room if the room's not clean, right? Because there's sterility and there's all these things. So don't underestimate anybody who makes patient care feasible, even if they don't have a certificate for patient care, even if they're taking out the trash, cleaning the bed, serving your food, you name it. And the same thing applies to this, right? Don't piss off the PhD. The guy who cleans the pipettes and the beakers and all that, they're performing a job that's essential for you to just be able to come in and not waste your time doing that instead of performing the actual experiment. So yes, I cannot reinforce that enough.
Alrighty, so for
And it costs you nothing, right? It costs you nothing to be nice to somebody.
one of the simplest things you can do. So the next question, is it okay if I have clinical research experiences only for my medical school application?
Okay, I will refer you back to the first 5 minutes of my lecture where I said I don't care if it's underwater basket weaving. I don't care what it is. I really, really, really don't. So again, don't obsess about it. I will tell you this. There is only one caveat regarding that. If you're claiming that your clinical exposure or your sole clinical exposure was clinical research, you have to be very careful about two things. Be very carefully spell out whether there really was a lot of patient contact or not, or whether you were just the one that was inputting the data in the computer. Because we have people that put it in their communities, in their clinical exposure section, and then they write the description. Well, I inputted the data and I did the analysis and I did the quality control. Well, that's not patient contact. However, if your clinical research really did involve research plus clinical, detail out how much of it was, or even if it's just in your own mind, how much of it was clinical and how much of it was research. Why? Because the thing that I don't like and that I'm really going to get pissed off at, and I kind of sort of hinted at it already, is like, let's say, okay, I can't do the hands up thing, but to give you an idea, we calculate that a 40-hour a week work job or any kind of 40-hour a week activity, you're going to get about 2,000 hours racked up, right? So let's say that you said, oh, I worked in somebody's lab for a year. That was a clinical research project, and I spent 2,000 hours doing that. Okay, well, but let's say that you did that, but then you also put it in your clinical activity section. Now you wrote, I did 2,000 hours that was research, and I did 2,000 hours that was clinical because I didn't spell it all out. You're telling me that you did a 40-hour research project and a 40-hour work week while you're trying to go to school. That doesn't add up, right? Because now you're telling me that you did 80 hours a week while you were getting some classes done and tried to get some sleep in. Hopefully, and also you try to take a shower. So don't overestimate the hours. That is a deal killer. That's unethical. I We literally had that yesterday. We had somebody who clearly way overestimated the hours that just didn't make any sense. And so the other thing, like I mentioned, was the double dipping. Like, don't try to put it in both columns unless you separate out the hours and say, I specifically spent this much time with patients and I specifically spent this much time with the research portion of the data analysis, whatever. You have to be a little detailed when it comes to the clinical exposure so that I don't get pissed off at you for double dipping or for overclaiming your hours. Other than that, I don't care what you do for research.
So speaking of which, just really quick, does the journal matter? Like what journal it's published in matter?
Nope. It's nicer to get now, impact is a thing. So you can look up the journal and see what their impact factor is. If you can get it into like things like that everybody knows, right? Like JAMA, and Nature and things like that. Those like a huge impact factor. The Occidental Journal of, specific neurosurgical, whatever, probably not going to have that much of an impact factor because it doesn't circulate as much and is a very niche journal. Like that's, I just made it up, but niche journals are not going to have as much of an impact factor. But again, that's not the point. And let's be realistic. At this point in the game, you are not going to be part of JAMA and you are not going to be part of
The decision making
the Nature, and you're not going to be the decision making and all. So don't sweat it. A publication is a publication.
is a
I don't care what
publication.
journal. The only and we don't go so much as to like look into the journals themselves and oh, he published in this, but that sucks. Because there are some journals out there that aren't so hot. I personally have a distaste for journals that charge you to publish. Don't spend money. I don't care how tempting it is. It's just not worth it. And like at this point in your game, spending $1,000 or more dollars to get yourself published is not going to benefit you in the long run. Just let your PI take care of it. Don't try to do something yourself. Don't sweat it. And quite frankly, you're probably not deciding what journal it's going to be submitted to anyway. So don't lose sleep over it.
Ernie, so for the next question, someone asked, do you need to have a degree in order to pursue research?
Nope. I have undergrads and or kids who only have a bachelor's degree. But again, if you're an undergrad and you're working in somebody's lab, you don't have a degree yet, and you're pipetting stuff for them, and you're participating in research, right? So, I mean, that's kind of sometimes you work in somebody's lab to get your degree and your bachelor's. So no, you don't have to have any degree to work in somebody's lab, especially if you're doing basic science. And I said, like a lot of these kids that come to me, most of them have at least graduated college. So yes, they're going to have a bachelor's, but to be honest with you, I really don't care as long as you have time to do the research project because like I said, my data is usually easy to obtain, and then I'm counting on you to make sure that the data is clean and do the data analysis on it, the actual statistics. So no, you don't need a degree.
Ernie, so for the next question, how do you look at presentations as well as posters?
Fine and dandy. Um, won't get you the extra brownie point like an actual publication, but it'll get you there. I see it on the application. And I'm like, okay, because really what that is that if you have a presentation reference, then yes, the work that you did was real, because you presented it somewhere. So it just kind of, it's a nice corroboration to your story, but not entirely essential.
The other thing that I would just add is if you're going to the big universities, UCI, Davis, LA, they have all of these like research poster presentations for students and participate in them, get practice at them because you don't want you know, your first presentation be at the American College of Surgeons or any of the big stuff so that, you get practice at it. So
Yeah,
don't
that's
look
actually nice. Yeah, I
don't
agree.
look off like, oh, I don't want to if there's something on your campus and you've done research, like put in your poster presentation and stuff. You don't want to do it at a big event. You gotta, you first gotta learn how to, crawl before you could run. So,
Yeah. No, that's
and a
nice because again, it shows that you worked on that skill and that you're not a complete newbie. So I agree with that. If you didn't do it, it's okay. Don't sweat it.
but take advantage of those opportunities.
Yes, also true.
Alrighty, so for the next question, someone asked, how does it look if they are the only author in their publication?
That's weird, and that's
I,
not going to happen. And it probably shouldn't happen because if somebody mentored you like that, I kind of find it hard to believe that somebody in the undergrad stage of the game already knows how to do all the research and they can handle it all themselves. I know there's the very like a unicorn who will write some paper that was like a kind of like an opinion paper or something that they submitted somewhere, an editorial, if you will, but that I don't take that seriously. Sorry. I hate to,
unless you have like a master's or PhD, and that's like really rare. Like at this point, most of you don't have to worry about that.
yeah. Somebody will have mentored you and that person should be on there too. Oh, by the way, a little bit of a don't, because I see this every once in a while and it kind of makes me be like, really? Um, in your research section, if you had a publication or you had a poster presentation, um, don't like, and and it has that thing where like, oh, the reference, who can I contact, like in case I needed to corroborate your story, for whatever reason. Don't put your own name. Please don't do that. Yeah, that's a little sketch. A lot of ego, turn off. And B, like, why can't, if I really wanted to talk to the person who mentored you or was the PI, why? Yeah, that it's a no-no.
All right, so a lot of people are wondering, how would you suggest getting involved in research?
Um, and that's going to be a very vague answer, but you go to your library and first of all, come up with an idea, right? What do you want? What are you interested in? And again, I kind of keep harping on it just because to show how silly and unimportant the actual topic is, but like the underwater basket weaving, right? Is there somebody who's written on underwater basket weaving or has something near there? Is there a person who infects mice with a potential, cancer tumor, and that's what you're interested in? Is there a person who works in neurology, a pediatrician, or something that you think you may have an inkling that you like? And go talk to that person. Go ask them. You're going to get a lot of no's. You're not going to get a yes right away. But you have to be a little persistent and you just have to knock on some doors. I mean, I kind of, not literally, but figuratively. And then you're gonna get some no's. So all it takes is one yes. But do your homework. The first thing is you do your homework. What are you potentially interested in? Any good institution like UCI, for instance, has a list. There's web pages, and I'm sure your own institutions have it, of what research people are doing. ICTS for us kind of does a little bit of that. And look up those resources because those are literally resources of people that are interested in students helping them out. Um, and because they just don't have all their own time or they're interested in future people like working with them. There is a reference out there, a web page, something in your own institution that's what they do is they compile people that like, hey, this guy's doing this type of research and he's looking for somebody to work with him. Uh, and that's actually a good resource wherever you are.
Yeah, we've done a lot of sessions in the fall about summer programs because those are great. You get into this network, they pay you, and then you get into this world of if you're interested in something else, you could find. But summer programs, and we've done a lot of workshops on those. So go back and
Yep.
look at those.
Alrighty, so for our next question, someone asked more about generally just about research. So they said, "Hello, Dr. Barrios. Although I agree with what you stated regarding research, and that research has created options for success to those who can afford these options, but are these new options tested for patients who don't have the resources to afford these alternatives?"
I'm not quite sure what they were asking there. Are you talking about the ethics of research?
I believe so. I think it was
They
more
were just
early
wondering
on.
if like let's say a new drug comes out and it's all, but people that don't have that can't afford it or is not covered by their insurance or Medicare or
Right.
Medi-Cal.
So that's an ethical political problem. I don't want to talk about that, not because I don't have my opinions on it, and I can briefly maybe talk about my opinions on it, but that's for you to figure out when somebody's trying to um, sign people up. There's actually boards that try to make sure, like again and again, I will mention the IRB, where there is an equitable access to these medications or these procedures, and we've literally turned down ones where they will say, oh, and by the way, because this is something that could be covered by Medicare, um, that we'll have Medicare cover it. And we've turned them down because they cannot guarantee that Medicare will cover it, for instance, right? And so that is an inequitable access to research and distribution. And we actually have problems with not enough Latino patients, not enough African American patients, other minorities signing up for this for that very reason. But that's, I mean, unless you really want to be that person from now, and you want to investigate how that PI is taking care of that project or making sure that it's equitable. There are already things in place to try to make it equitable, but you can go and try to figure it out on your own, and don't work with them if you don't want to. There are plenty of basic research, like I said, that it doesn't have to be clinical research, and it doesn't have to include your concern at this point in the game for whether that person is conducting equitable access to the research, because it is an ongoing problem. I agree. You're not wrong. But that's for institutions, and that's for politics, and that's for people like me that sit on IRBs to make sure that they're trying to get equitable access for the patients and turning down the ones that clearly are not equitable.
Yeah, and usually when drugs come out at first start is not accessible to everyone, but then scale and everything else brings the cost down. Like for example, the diabetes machines, when they first came out, insurance wasn't covering it. Now everybody has it and their costs have come down. So yeah, the whole point of discovery and mass production and things like that play a big part in that. Do you want to jump to the next question, Matthew?
Sure. So someone asks, is there an approximate minimum for research hours if they have, like, let's say, plenty of other hours related to clinical exposure and volunteer hours?
Is it a deal breaker if you haven't done any research whatsoever? No. We do occasionally take the kid that hasn't done any research. You're just not going to get the points for it in that part of the application. But again, if you killed it everywhere else, is it going to be a deal breaker for me? No. And in fact, there are some institutions I do know that don't care at all. Like, and it's just not a big deal for them. It's not a deal breaker for UCI, but yes, we'll give you points if you did do research, and you're just not going to get points if you didn't do any research. I cannot tell you my formula for how many hours I think is an average amount or not. A little proprietary because, and two, we are bound to be vague because we are very concerned about, well, Dr. Barrios said that if I did X number of hours, it's going to get me in the door, right? And what if you didn't? Then you can turn around and say, well, he gave me the wrong information, and then it turns into an awkward thing for everybody. So I cannot tell you the hours.
It's
All I can say,
qualitative, not quantitative.
it's qualitative, and I will tell you that, again, like I said, I would rather you see that if you spent a year with somebody doing a goodly number of hours as opposed to 100 hours here, 100 hours there with so and so in a lab for a couple of months. Think about it that way.
And the nice thing about summer programs is you're working full time, so the hours do add up. So 10
Yeah.
weeks, 40 hours, that's 400.
Yeah, I'm not poo-pooing the summer research things, because you should put those down and you should have those under your belt as well, because again, that just shows that you were at least trying to dip your toes into the research world.
Yeah, every single person that I've ever talked to that's done a summer research, that after it, they've either continued in the lab or they went across back to their own campus and got a connection to because everybody knows everyone.
Yeah.
Alrighty.
But
So, oh, sorry, go.
go ahead.
So for the next question, someone was asking, how does it work with letters of recommendation from PIs when you were supposed to be handing in only 3 letters? So how should they prioritize which letters of recommendation they give if they have, like, let's say, several long research experiences?
Yeah, I kind of hinted at that. Hit up the person that you think you had the most exposure to or had the most communication with, or it doesn't necessarily the longest hours, because the longest hours may not have necessarily been the best. You sat with them and you opened up and you talked a little bit while you were waiting for, some timer of something that you put, in an oven somewhere, or, so, and you should do that for all of the activities. Pick your best one from what you thought was your most meaningful or your most communication with somebody in the clinical exposure that you did, and the community service that you did, and the research that you did, and that'll get you 3 letters, plus maybe somebody that you took a lot of classes with or had a good interaction with. Biochem 101, I spent a lot of time with them in their office hours and the lab, and we got along and we chit-chatted. That's okay too. The max should be about 5 letters anyways. If you do any more than that, it becomes eyeball rolly for me, because it's more work for me. And I will give you an example, not to brag, but just to show you the amount of work that goes into this stuff. I read 950 applications this year. So I almost had to call my therapist after that. So don't do more than 5 letters. Try to get one most meaningful one from any and all of those activities and work your way from there. If you didn't get to 5 and you want to do a second one from one of those, that's perfectly fine. But again, try to max out and try to get the most impactful one from that, at least from any of those activities.
Alrighty. So for
Yes,
next,
and we're still getting this question again and again. This is something we're going to reiterate. People are asking, what if social science research? Can you just say that again? Research is?
I don't care what you do your research in.
So, well, what about sociology? Is that okay?
I don't care what you do your
What
research.
about psychology? What about astrology, astrobiology?
Yeah, I don't care what you do your research in. I kind of hinted at it. I don't care if you're working with plankton. I don't care if you're working with baskets. I don't care if you're working with sociology. I don't care if you're working with climate control. I don't care if you're working with
AI.
AI. It doesn't matter. Did you do the activity? Did you learn from it? Did you learn how to do the lit search? Did you learn how to do the IRB? Did you learn how to, even AI requires interaction with the IRB if you're picking out stuff from patients' charts for the AI machine to learn. You know, was it that you created a new toy? Doesn't matter. So I hope that answers a lot of those, because I'm actually kind of scrolling through it a little bit right now, and I'm seeing exactly that. Doesn't matter what the basic topic is. Put a good description. What did you learn from it? What did you take home? Why was it impactful? What aspects of research did you learn? I learned how to write an IRB. I learned how to write an abstract. I learned how to do good statistical analysis. You put all that in there, but it doesn't matter where that came from. Did you work with fish? Did you work like, I don't know. I don't care.
Alrighty. So for the next question, someone asked if there are certain specialties, like medical specialties, that are less political or bureaucratic compared to others. Have you
Let me
had
introduce you to the world of medicine. No.
No. Medicine is the most regulated, most political thing you could find. So no, everything is unfortunately no. Healthcare in this country.
But yeah, no. It is very bureaucratic. I sit in enough committees, that I get bashed over the head with politics sometimes, and I'm like, all right, it is what it is. But if you're worried about that from now, don't go into medicine, please. Because you're going to be setting yourself up for a lifetime of hurt.
Yeah, and
already?
and this is something that I just want to add is I don't own a TV, but every time I watch a TV that has anything medical in it, they show people that like don't follow the rules or they're it's like that's a really good way. If you're the kind of person that is like that,
Yeah, the kind of person that goes rogue, or the kind of person that is what's the word I'm looking for? Not cavalier, but they're because it's funny because I used to tell people that I kind of sort of enjoyed Alan Alda, who played Hawkeye in MASH, and guys have no idea what reference.
what's yeah,
But
Love MASH.
yeah, so I kind of liked it, but then I realized over time you can't be that much of a, independent kind of person bucking the system all the time, because you're eventually going to get pushed out. I mean, that's just not realistic.
House MD. Do not follow his advice. Alrighty. So, the next question is, okay. So how does do you could you speak a little bit about how UCI admissions select merit scholarship recipients? Is it holistic? Is it based on solely academic performance? If you could give any sort of, I guess, inclination.
Yeah, merit is outside of what I do. I don't do the scholarships. I'm only worried about, um, and I'm not going to give you the name of the person who is responsible for that, because she'll hate me, because then you're going to email her. But I'm looking at your grades, your MCAT, your personal statement, or statements, because they're secondaries. Your interviews with people, because you're going to get three different types of interviews. You're going to get an attending like myself, you're going to get a medical student, and you're going to get a virtual interview where you go online. It's called Kira, and I think we're going to change it, but don't take my word for that one. But and you're going to talk, and you're going to answer into the computer. But all those require different skill sets. And again, don't piss off the medical student, because we take those interviews seriously. And then I'm going to look at your activities section, and I'm going to look at your letters of recommendation. That's enough pieces of the puzzle. And I will tell you this, although we're going off topic a little bit, but I don't need a 4.0, and I don't need a 99th percentile on your MCAT. I often actually look at those with a grain of salt and see what the interpersonal skills are. And so the interviews really do matter, right? Because if it was just a matter of like you were academically awesome, then I wouldn't care and I wouldn't invite you for an interview. I just look at your 4.0 and your 99 percentile and go, okay, I'll take that one. But that's not how it works. I tell people, as cliche as it is, medicine is a people person job. And so interpersonal skills are important, because if you're not a nice person, patients aren't going to want to come back to see you, and you're going to have a problem. And other physicians are not going to want to refer patients to you, and then you're not going to have patients either from that aspect. Or people will get passive aggressive, and you'll ask them for a result on some patient, and like that result may or may not get back to you. Or they will straight up tell you like, please stop contacting me for that. And so again, interpersonal skills become an issue. But let me see, is there any other? Is it bad to apply to MD PhD programs? They're very selective. They will tell you on their website what they're looking for, and they're looking for people that have done thousands of hours of research. So if that's you, give it a whirl. If you know already published at undergrad, give it a whirl. But those people I can tell you are very demanding, and uh, that's its own subset of how they pick that.
Yeah. Those people spend, I mean, I know a couple of people that do MD PhD that did like 2 years of post-bac research full time in a
Yeah,
lab.
exactly. So
Um, did you get that message that I sent you
which one?
in the chat?
Hold on. I'm kind of sort of reading. There's like an open 3 questions right
No,
now.
it's the
Oh, in the
chat.
chat. Oh, hold on. I was not opening up my chat. Uh,
Um,
things you learned in kindergarten. I like that.
it's the very end.
Yep, that's fair. Yep.
Okay. All right, I'll send that to you right now.
So, yeah, go ahead. Are we wrapping up? I guess we're kind of like,
Yeah,
but
we're almost
I
done.
want your take-home message to be positive because I know you guys wring your hands and I know you guys worry and I know it's so multifactorial, but if there's anything I can just say is again, please don't stress about what the topic of your research is, and please don't stress about the worry about the politics. It's often above my pay grade. Um, please don't worry about the certain hours or whether you were first or second on the paper or whether you got publications. It's all nice, but it all doesn't really matter. All we want to see is that you put a few hundred hours in, that you spent maybe an academic year. And if and the couple of, the don'ts of don't try to overblow your, blow up your actual experience because that's gonna hurt you, and have fun doing it, right? Like I do what I do because I have fun with it, right? The questions that I answer are because what I really want to know and not because I feel compelled to, like, oh, I didn't do enough abstracts this year. I do it because, like, I will tell you an example. Like, my 2 of my recent projects that I have people working on, and one's actually um, not a physician at all and is working in the emergency department. But it was like, we have this thing at UCI where we change the seat collars out on trauma patients. And I'm like, well, why do we even do that? And we have an old little machine where we check the patient's hemoglobin. And I'm like, does that really matter? And so these are questions that just pop into my head that all of a sudden has now turned into a research project. And I have fun answering that because I know that if I get the answer that I want, I'm probably going to change our practice. I'm probably going to get rid of those things that are wasting money and not mattering. So it sometimes just boils down to you're being observant, and figuring out a question for yourself and working your way from there. And that's okay, and that's enough. And you don't have to sweat it. And like I said, for us at UCI, for instance, not even a deal breaker if you don't have any. And for some institutions, they don't even care if you've done any research. So do a little bit of homework and read up on those institutions that you may want to go to, and kind of they should have little hints on their website of what they're looking for.
We have 2 short questions we could ask, and then we're just going to close out. So these are pretty fast.
Yeah.
Go ahead, Matthew. You want to ask?
Alrighty, so for the first one, if someone is a registered nurse, can they list their school clinical experience as non-paid clinical experience on their application?
I'm actually seeing it. Can I list my school clinical experience as non? No, your school experience was your school experience. Don't try to palm that one off. If you're a registered nurse already, just post your clinical experience as a nurse, and that's fine.
You'll have plenty and more advanced than almost most applicants. So
Yeah, seriously. If you did 1 year of nursing, that's 2,000 hours. So, think about it.
and don't work as a nurse for free. That's all I got to say.
Yeah, seriously. No, but your nurse, your clinical rotation hours that I know you guys have to do. Sometimes you have to do some practicum and stuff like that. No, don't list that.
All right. So then for the last question, how do you write about your research or lab experience without it seeming like you're just listing your daily responsibilities? So like just
Some of those you will always have the opportunity to write whether it was a meaningful experience for you. And if it was, you write that. You write, well, it was meaningful because it taught me this or that. Or I learned some skills, or I learned what the underpinnings were. And, as long as it's sincerely true that was your experience. But um sometimes some of those things are, right? Sometimes you went into that lab and all they let you do was pipette. But like, did you get something? Did you learn something? You're gonna list your responsibilities of it. Um, and 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 that's okay too, right? Because I joined somebody's lab and I learned the importance, because everything is important in terms of, like, yes, maybe only you pipetted, but was there a mistake? And did you realize that, man, like, I ruined life for everybody because I made the mistake with the pipettes, or I put something in a refrigerator that didn't have the right temperature? And how did you recover from that? Did you learn from your mistakes? And sometimes that's why it was meaningful. Not that it had an outcome that affected everybody, but that you learned, like, darn, even the basic stuff is important. And I learned from my mistakes, and I learned how to pivot. And I learned to pick myself back up after I cried a little bit, and went back to it, and then it was appreciated that I did it right from then on. There's ways to spin it. I'm a big believer in being a little bit of a spin master. Um, so just you can sometimes be a little creative. Just don't be too self-aggrandizing. If it weren't for me, this experiment would never have happened. Like, yeah, yeah, no. All right. I hope that was helpful for everybody.
Thank you.
Uh, and
I send you that link too.
okay. Did you email it to me, or did you?
Yep.
Okay, I will
Yeah,
look at.
email it to you.
I will email it and pop back on the other way.
Okay. Well, thank you again for joining us, Dr. Barrios. Thanks everyone for coming. We got all the questions answered. And the only thing I would just say is go back and look at because I think Dr. Barrios has spoken like 6 or 7 times. So he has many other talks that he's done specifically for admissions. So look at those, and hopefully we'll see you again on the flip side. Or
Yep. All right, guys. Until next time.
thank you.
Thank you.